This will be the video for tracheostomy suctioning. Prior to suctioning, the need should be identified through assessment findings. You should perform hand hygiene and gather your equipment. Equipment needed will be a sterile suction catheter kit, an ambu bag and an oxygen source, clean towel or drape, sterile water or saline, mask with eyewear, a stethoscope, and a pulse oximetry attached to the patient if indicated. You should identify your patient using two identifiers. In a nonverbal patient, you may compare the hospital ID number and the patient's date of birth to the medical record. In an extended care facility, a photo ID would also be acceptable, and if a family member is present, they also would be acceptable for identification purposes. Next, you should explain the procedure to your patient.
Ms. Smith, I'm Annette, a nurse, and I'm going to perform trach suctioning on you today. If at any time during the procedure you have any complaints or experience any distress, I need you to raise your hand for me. Can you do that?
Next, you should position your patient in mid-Fowlers unless there are contraindications. Test your wall suction or your portable suction. Wall settings should be 120 to 150. Portable settings would be 5 to 10.
This is portable, so when I turn it on, I need to pinch and clamp the end of the tubing, look at my gauge, and see what the maximum pressure that's applied. And it is set to 10. If it was higher, I would need to adjust it to 5 to 10.
Next, we would pour our sterile water or saline into the basin from the suction catheter kit. When you open your kit, be careful not to contaminate.
This is the container that you'll pour your sterile solution into. It has a plastic lining, so make sure that you do not touch the inside of the lining. You can only touch the outside or the bottom of the container. If the plastic is up like that, don't worry, the solution, when you pour it into it, will cause it to lower into the box.
If the solution has been opened, you should check for expiration date and lip the container prior to pouring into the sterile container.
This has been opened, so I will need to lip it over my garbage and make sure that I pour from the same area that was lipped.
Being careful not to touch the bottle to the container. Next, you need to put on your sterile gloves. Now you need to get your catheter. You want to hold your suction catheter in your dominant hand. And you will attach the suction tubing without contaminating the catheter or your dominant gloved hand to your suction apparatus.
My dominant hand is my right hand, so I'm going to hold the catheter in my right hand. My left hand will become contaminated along with this area, which is going to connect to my suction tubing. I want to protect that tip of that catheter so it does not become contaminated.
Next, you should turn on the suction and verify that the equipment is functioning properly by suctioning a small amount of sterile saline from the basin.
I will turn it on with my contaminated hand. There is an opening there that I will use to occlude and check to see that my suction is working.
The patient should be hyperoxygenated with 100% oxygen for a minimum of 30 seconds through the trach collar. And this patient has their trach collar on. Now we will insert the sterile catheter 4 to 5 inches after removing the trach collar. If resistance is met or the client coughs, withdraw the catheter a half an inch. Apply intermittent suction by occluding the Y port catheter with thumb and gently rotate catheter as it is being withdrawn. Do not suction for more than 15 seconds at a time. Now you will need to ventilate your patient with the ambu bag for 3 to 6 breaths and replace the oxygen delivery device. Now you should suction sterile water or saline through the catheter to clean residue. If it is necessary to repeat the procedure, you would do that now.
So I need to assess my patient to see if they need further suctioning. So I could check their O2 sat monitoring that is on their finger, and I also need to listen to their lung sounds.
Be sure to replace any ordered ventilatory appliance, as in the trach collar or whatever the patient requires. Disconnect the catheter from the connecting tube. Roll catheter around fingers and pull the glove off inside out so that the catheter remains in the glove. Remove the other glove and discard into biohazard bag. If you have not turned off your suction, you need to do that now. Put on clean gloves and remove your mask with eyewear. You will discard the remainder of any used equipment at this point. You should remove your gloves and perform hand hygiene.
I want to remove my gown.
You should record the date, time, the reason for the procedure, hyperoxygenation or hyperventilation before and after the procedure, the catheter size used, the amount, consistency, color, and odor of any secretions, and your assessment findings after the procedure, which should include breath sounds, respiratory rate and effort, O2 saturation if applicable, and your legal signature.